Having worked in global digital health for some time now, I often find myself thinking about the rapidly evolving intersection of health and technology. In particular, the intersection of gender and tech for female health workers on the front lines of care. It's an issue that everyone who works in global health and development should be thinking about. I'm Emily Nicholson, Digital Health Specialist for UNICEF's regional office in Latin America and the Caribbean. I work with governments, UNICEF country offices, and our partners throughout the region as they embark on the digital transformation of their health programming. Things are changing rapidly in the health sector for all of us. For those of us who don't have consistent access to connectivity, trainings, and resources, it's exceedingly hard to keep up. Women account for 67% of the global health workforce, yet hold only 25% of leadership roles in this sector. This leadership gap results in women providing much of the care we receive without having equal representation in decision-making. Globally, the health sector is undergoing a digital transformation, aligned with a shift from paper to digital and the catalytic use of individual patient-level data to drive research, programming, and policies. The pandemic has expedited the transformation, increasing the proliferation of digital devices, platforms, and tools used by the health workforce. It's ever more necessary, then, that the health worker be able to navigate and excel in an online, digitally enabled, and connected world. Yet there is much evidence highlighting a gender-digital divide. The lack of access to, use, and development of digital tools, platforms, and systems by women as compared to their male counterparts. The gender-digital divide is growing ever larger, leaving women and girls behind, at the same time that the use of digital is everywhere accelerating. What does this mean then for female health workers caught in the swift transformation of the health sector, a sector that's led by men but dominated by women? How does the rapid introduction of digital tools and devices impact them, and by extension, the nearly 5 billion people worldwide who receive essential health services from these women? For my WomenLift Health project, I wanted to speak with female health workers on the front lines of the digital transformation. I wanted to hear directly from them how they felt about the introduction of technology into their work. I traveled to Honduras, where, along with colleagues from UNICEF and Child Fund, we interviewed 100 female community health volunteers about their experiences receiving trainings on COVID-19 via WhatsApp, as opposed to the in-person courses in which they traditionally enroll. Implementing this project gave us a glimpse into what the digital transformation looks like for women within the community health workforce. Females who play a critical role in many health systems and for whom the rapid introduction of digital tools may be a challenge. Of the women we spoke with, over a third had a 6th grade education or less, and well over half did not graduate from high school. They were younger than 25 and older than 70, and almost every one of them had a smartphone. Most of them use WhatsApp. 67% reported using it every single day. Yet at the same time, a large portion of them knew only how to use the platform to make calls or text, essentially simple flip phone functionality on an internet-enabled device. Though we are still analyzing the data collected through these rich conversations, several key themes are already rising to the surface. When asked what they learned through the trainings, almost half reported learning how to use WhatsApp in a new way. Not only how to fill out survey forms or click on links, but how to block callers and add contacts. This is significant because providing CHV training through an app they already have on their phones is a sustainable way of sharing new content, while also enhancing their digital literacy skills. They spoke of the pros and cons to virtual trainings, with some stating that they preferred the social aspect of in-person trainings and the accountability it engendered. Others preferred online courses, noting a lack of money to travel and commitments to family and children often limited their ability to participate in face-to-face trainings. Courses deployed through WhatsApp alleviated these barriers, allowing them to participate in their free time when it best suited their schedules. This is significant because the flexibility provided by virtual courses meant that these women did not have to choose, as women are so often forced to do, between caring for their families and growing their careers. Taking courses on their phones allowed them to do both. The women we spoke with had immense pride in their roles, and so many of them asked when we were going to deploy another course, even suggesting topics for future trainings. Their desire for more knowledge was insatiable. This is significant because there is a measured demand for more trainings, for more information, for more knowledge through digital platforms to build their skills and bring health messages to their communities. WomenLift Health has been a phenomenal experience for me, both personally and professionally. I've developed an authentic and inclusive sense of leadership, digging into a topic I've long been passionate about and advocating for the inclusion of other voices. This journey has also enhanced my sense of strategy and raised the bar by which I measure my own impact, imbuing in me the courage to think bigger and to share what I'm learning widely. The unique needs of women must be considered every time and everywhere digital health technologies are designed, developed, and deployed. Thank you.